What can be done to improve world population health? We'll analyze different factors that most influence life expectancy and identify measures leaders should focus on. Let's look at life expectancy analysis, where we see different health indicators by country. The blue line is health expenses per capita, and the green line is life expectancy. Government spending alone is not a good way to increase overall life expectancy. Some countries have slowed spending, but life expectancy is still growing. This is not true for the US, which clearly didn't make the leaders quadrant for those measures. With a simple right click, we can resort the data, and the health expenses in the entire trellis chart changes. Let's now filter on a specific value of an indicator, in this case, average years of secondary schooling. The visual shows aggregated values by country, and I select those with at least 4 years of secondary education. The whole dashboard is filtered with less countries meeting the criterion. The tree map shows health expenses per capita. The larger the area in the tree map, the higher the expenditure. If you want to add life expectancy in the tree map and display color, simply drag the measure onto the color bar, and the tree map is expressed in terms of expense and longevity. The darker the color, the higher the life expectancy. For example, the US has large expense but lower longevity, where Italy has longer longevity with less per capita expense. Overall, males have a lower life expectancy than females. We also display other factors by gender, including infant mortality, obesity, and alcohol consumption. Clicking on a country in the tree map, we see the filter applied to the visualizations next to it. Looks like Australia alcohol consumption is higher than the US. If I click on Italy, or better yet France, I can see that alcohol consumption is even higher. Can we assume the more men drink, the longer they live?